I'm Trevor, and I'm going to be your nurse for the day. If I could I get you to just state your name and date of birth? Alright. Are you allergic to anything? Betadine, iodine, or latex? No? Alright. Okay. What we're going to do today is I'm going to wash my hands real quick. And I'm going to put the curtain to give you a little bit of privacy. What we're going to do is I have an order for a Foley catheter. Put you in working height. What that is it is just it's a tube. It's going to go into your ureter and up to your bladder, and it's going to help you. Drain your urine. Do you have any questions? No. All right. So I'm going to put on a set of gloves. And what we're going to do is we are going to clean your perineum before we even get started. This up real quick. I'm going to clean your perineum with soap and water first, and after that is clean, I'm going to take my gloves off, and I'm going to wash my hands again. Alright, and then we will be ready for the catheter insertion. I'm going to make sure the bed is at working height. It already is. And then I'm going to make sure you're in supine position, which is the correct position for a male. Take my catheter out, and this is going to be used as a garbage bag. Set that right here. Alright, I'm going to begin by opening it outward, side to side, and then towards me. And I need to grab my gloves, so I'm going to shimmy them outwards until I can grab them. Alright, now that I have them, I'm going to put them on. Situated. Everything's sterile now, so I can touch everything in my sterile field. I have the drape. I'm going to put this shiny side down and just lay it down like that. I have this, and this is going to go right above him, like so. Alright. And now that I have a sterile field, I can get everything out. Alright, and first I'm going to get the sterile water and take that cap off and put it here, and I'm going to plug it into the catheter. Make sure that's ready. I'm going to take the lid cap and take that off. Set that back down in there. Alright, now I have my specimen cup. I'm going to set that right here on the table and make sure it stays sterile. Alright. Now I'm going to get the catheter ready for when we need to insert it. Okay. Now, since he's not allergic to betadine, we're going to pour all this on the cotton balls and throw that away. And now that to clean it, so with my left hand, my non-dominant hand, I'm going to grab the penis, and now it is unsterile. And with my right hand, I'm going to grab the cotton balls and clean from the meatus down onto the shaft in a circular motion and drop that in the bucket. And I'm going to keep doing this with all of my cotton balls until it is perfectly clean. Two more. Alright, I'm just going to drop everything in there. And now I have the lubricant, and I'm going to inject that directly into the penis. Alright, and then drop that. And now I have the urinary catheter. I'm going to tell the patient that he's going to feel some slight discomfort, but if he feels any serious pain, tell me and I will stop. But for right now, we're going to insert the catheter all the way to the Y in the catheter for a male, which is right there. And I'm going to hold that, and I'm going to inject the saline into the bubble and the catheter. And it should be 10 milliliters. And then still holding on to it, I will undo that and drop it in the bag. And then I will slightly tug on it until the bubble hits the bladder's end, and I know it will be in place right there. Alright, now we're going to tape the catheter to the abdomen for man, which will be right here. Alright. And then I will have the bag and make sure it does not go above the bladder. And I will put this down here, hook it on here, but make sure it is not on the bed rail because you don't want it above the bladder. Alright, and if we wanted a specimen, we'd take the cup, we would take it down here, and we can get it out of the bag right here because I just inserted it so it's still clean. And insert it into here, clamp it off, clip it back in there, and then I will send this off to the lab, and then I'll proceed to take my gloves off and wash my hands, and then I would clean everything up, set this over here. And then I would cover him back up and ask if he needed anything else, and then that would be done. And then later that day, I'd have to come back in, and I would say that we needed to take the catheter out, and I would get him to state his name and date of birth, and check that with his order, just to make sure it is actually him. And then I would wash my hands, and I would put on gloves. Just regular gloves. Alright, and I would lift this up, and I would get the 10 milliliter syringe, and I would proceed to put that right in there for right now. And then I would come down here and I would drain all the urine out of the bag into a bedpan, and then unhook it and come up here, make sure not to put it above the bladder still even though it's empty. And then I would release the bulb, which would be 10 milliliters, because that's what I inserted, and I would make sure it was all 10 milliliters. Just a little bit more. from his abdomen and tell him to take deep breaths and pull it out very slowly. And then I'll dispose of this properly. Cover him back up. Put the bed in lowest position and raise the bed up into semi-Fowler's position and ask if he needed anything else. And I would take my gloves off and wash my hands. And if he didn't need anything else, then I would be